guys, this is Jessie from Speakeasy Pilates. Today we're going to be going through a short, quick, and dirty lower back health little repertoire that I put together. This is for when you just have issues in your low back. You're not really sure why. Most low back pain comes from repetitive use injury, like you're using it too much to do too many things. Or you have just poor mechanics. This isn't necessarily for someone who has like a pop disc or anything like that. This is just general low back pain, all right? So this is not a banger workout. You're not going to be sweating and grunting and groaning. It's mainly just to bring some relief, all right, into those joints. So today I'm going to be using a lacrosse ball. This is really, really, really great to help break up sticky, dehydrated, tight connective tissue. And the connective tissue that we're going to be concerned with is the sacroiliac joint that connects the back to the glutes. All right, there's a whole bunch of connective tissue back there that gets mega tight. Okay, so let's go ahead and lay down on the back. The first thing we're going to do is you're going to come into that supine position. Look, see that light? Let's go ahead and bring the lacrosse ball underneath, like not right on your glute max. I'm trying to put it in my sacroiliac joint, right? That connective tissue. So it's sort of in that ridge where my butt meets my low back. And then I'm just going to gently rock side to side. Now, if this feels like searing hot pain, take it away. Pain is the body's way of telling you too much. All right. If there is some discomfort, it's okay. That just means that that tissue, like I just hit a spot right now that feels very tight. So I'm just going to I'm going to breathe into it. I'm going to will that tissue to relax, to relax, to relax. I can kind of rock side to side here. Lacrosse balls, if you don't have one already, they're very, very cheap and they're very effective for connective tissue release. I'm just rocking back and forth a little bit. Ooh, I hit another pain point. Not pain, but I can definitely feel that there's tightness there. And I'm going to breathe into it once again. So this is something you can't really hurry. You kind of just have to melt into it and breathe. And I find that my glutes are able to lower even closer into the mat. Now I'm laying my glutes all the way on the mat, even with that ball there. So I know that there's been some release on this side of my glute. Now you can hang here for as long as you need to. I don't want to rush you. You may want to stop the video and just take your time in this position because we have to do it on the other side. All right, so let's go ahead, put it on the other side. Like I said, if you want to stop the video and just hang and release, I highly recommend it. Let's just breathe here, relax. We want to keep that connective tissue strong but supple. You know, because you think about it, where do we get injured? We get injured in our joints. You get injured in your connective tissue. You get injured in your elbow, your shoulder, your hips, your knee, your ankle, your sacroiliac, your low back. So we want to emphasize taking care of those joints. Rolling it around here, release. All right, so like I said, you can do that as long as you need to. And I'm going to take that ball away. I could probably hang out here for a little bit longer, but just for the sake of keeping this video moving, we're going to take that ball away, set it to the side. I'm going to place my feet hip width apart. My hands are alongside my body, right? I'm going to spread my toes and I'm going to roll. See how I'm rolling? I'm going to roll my hips up. Not this. See, I've got a dip in my back. We don't want that. I've got a nice imprinted spine. And we're going to take pelvic clocks. You're going to stir your pelvis around. You can go small with these clocks, or you can go big with these clocks. But we're going to try not to lose our imprinted spine, right? So you don't want to sag in your low back at any point. I'm really activating my glutes here. Think of this as like massaging that joint, activating those glutes. Because sometimes our low back hurts when our glutes go to sleep. All right, our low back ends up having to do all the work that our glutes should be helping out with. We're going to reverse that. Pelvic clocks going the other way. I'm putting weight into my heels. And breathing nice and deep, smooth, nothing is forced. Your knees can move a little bit here. Let's restore some mobility to that low back. Let's go 3 and 2 and 1. Good. Now let's roll that spine all the way back down. My tailbone is the last thing to touch. I'm going to bring my legs into a tabletop position. And we're going to do what we call lumbar rotation. I'm going to bring my knees over to one side and sweep those legs over to the other side. You may feel a stretch in your glutes or not. Maybe you feel a stretch more in your side waist. Rotating left and right. We're going to try to keep our shoulders on the mat. Rotating that spine. Moving those hips around. Let's do one more. Let's bring those knees all the way over to one side and just let those knees fall as far as they're able to. You can extend that opposite arm. Sending some good vibes into your low back. Our low back does way too much work for most of us, especially if you sit a lot. And then you can reverse that. Take some deep breaths. Let's bring those knees back to tabletop. Okay, we're going to activate your low abs, your transverse, your TVA muscle. All right, I want you to place one hand on your low belly. Okay, let's take a big inhale through the nose. And then out of the mouth. I want you to feel if you can experience any tightening down there, even if it's just baby tightening. We'll take it. Let's take inhale. So that breath activates that deep, deep stabilizer muscle in our low abdomen. When we have a strong TVA, that provides a lot of protection and stability to the low back. Inhale. Now let's keep that tight. It's almost like you're bracing the belly, preparing for someone to punch you in the stomach, okay? Let's keep it as tight as we can. We're going to bring right leg into tabletop, left leg into tabletop. I'm still bracing my stomach, and I'm going to try to tap my toes. This is called the toe tap. Imagine that. Very descriptive. So every time we extend that toe, let's take a little exhale. So here's what goes wrong in this one. You can see my back arch. No, that is going to hurt your back. We're going to stay in that braced position with your transverse. There you go. Now, if this isn't too much on your quads, let's tie an imaginary ribbon around these legs and try to lower both legs just as low as we can maintain that imprinted spine. Use the breath. So every time those toes lower, let's exhale and exhale. If this is too much, either on your quads or your back or your core, just do one leg at a time. And we'll do last one here. Bring those knees into your chest, and I want you to roll those knees around. Roll those knees around. Now we're going to do some more TVA activation, doing some more core work here. When you have a strong core, that is going to help your low back. All right, let's go ahead and lengthen right leg long. Pull it in. Left leg long. Pull it in. You want to make this a little bit more challenging, a little less stable. Place those arms up. Now let's pretend we're on a bicycle. We're going to pedal those legs around. There we go. Using that breath, you feel that activation in your core. I'm not arching my back. Reverse that pedal. Let's go 5 and 4 and 3 and 2 and 1. Good job. All right, plant the feet on the mat. We're going to go back to those glutes. Okay. Strong glutes supports that low back. So you want to get the strongest buns you can possibly get. All right, we're going to roll it up into that low bridge. My ribs are still down. At least most of them are down. Some of them are down. A few of them are lifted. That's okay. All right, so I want you to squeeze your butt and give me a little hip thrust here. It's small. We don't have to go crazy with this. All right, guys. Just think about building a strong glute max to protect your back. A lot of back issues really do stem from having a weak butt. It's a condition called gluteal amnesia. Your butt literally goes to sleep. It switches off. It stops working. This is another condition that happens a lot when you sit too much. Now hold it here and give me a little pulse, little pulse, little pulse, little pulse. Think about back health. All right, we're doing this for your back. You got it. And 3 and 2 and 1. Go back to that little bridge. All right. Anytime you need to take a break, you can. It's all good. We're going to be here. We're not going anywhere. Keep it up. So this is the kind of thing that you can do, this little exercise program. You can do this before you go to bed. You can do it when you wake up in the morning, you know, just to kind of set your back up for the day or the evening. All right. And if you keep it up, I hope that you will discover that your low back may start to feel better. We're taking some of the pressure off that lumbar spine. So I've gone back to those teeny tiny little pulses. Here we go. Now let's swing the booty, okay? Like our booty's in a swing. I'm going to swish my hip right and then left, and right and left, right and left. There you go. Perfect. Good. You see, you might feel this in the backs of your legs, your quads, your hamstrings, your calves. Right now, we're going to reverse that swish. So you're going to dip right hip low, left hip low, Right hip low, left hip low. Caring for our low back. I have a client who told me that she no longer gets steroid shots in her low back after she started doing Pilates. So we'll take that. We will take that. It doesn't get any better than that, right? Let the body be the medicine to the extent that it can. All right. Let's do one more set of pulses, right? I'm still keeping weight into my heels. If you need to come down and rest, fine. That's all good. And 3, and 2, and 1. Now let's see how smoothly we can roll out. Good job. Lengthen your legs. I want you to pull one knee into your chest. Just think about that connective tissue getting stretched in your low back. It's getting pulled. If it feels good, stir that leg bone around that hip socket. If it doesn't feel good, just hold it steady. You can stir the other way. And then we're going to take a little piriformis stretch, figure 4. All right. Sometimes that piriformis muscle gets so tight, right? And let's see if we can pull it in. A tight piriformis is going to mean a tight low back eventually. Piriformis is a very, very, very deep muscle in your butt, and it's involved in hip rotation, leg lateral extension. One more deep pull. And let's do that little stretch on the other side. Pull that left knee in. I want you to visualize pulling this knee away from that foot, right? This is an active stretch. It's not a passive stretch. And then you can stir that leg, that femur bone around the hip socket, just lubricating that joint. It's all about the joints, you guys. It really is. We got to take care of our joints. Let's all try to be injury-free, right? As we go through life. That's the goal. All right, piriformis stretch on the other side. You may find that one side is tighter than the other. Hold it and breathe. You may find you have a little bit more range after all that lacrosse smashing that we just did in that sacroiliac joint. All right, you guys, let's turn it over onto our hands and knees. We're almost done. We just got 2 more exercises. Okay. We're going to do the bird dog. Excuse me, not the bird dog. Yeah, let's do the bird dog. Okay, the bird dog, I'm going to do it incorrectly first, okay? See how my back is kind of saggy? Let's see if we can maintain a neutral spine. My knees are right underneath my hips. We don't want to be like this, and we don't want to be like this. All right, knees right under spine. And let's just break this into pieces, okay? We're thinking about low back health here. You're going to extend your left leg long. And see if you can do it without turning out in that hip. And then bring it in. And one more. Now, if you want to do the full bird dog, you're going to take that opposite hand. So right hand and extend. Now, I want you to actively pull your right fingers away from your left toes. Think about all those little stabilizer muscles that line your spinal column. When we have a strong spinal column, we have less tendency to wobble. This activates your posterior oblique system. That means your lats, your sacroiliac joint and your glutes are all working together in one system. And your deep stabilizer muscles, I forgot to mention. All right. And if all of that just sounds like gobbledygook, that's all right as well. But for me, I like to know the point of why I'm doing things. I always want to know the why. Hold here. Reach that finger away from that heel. Get some length in the back of that knee. 5, 4, 3, 2, and 1. Bring it in. Ooh, see? Let's do a little cat-cow. All right, let's do that on the other side. So now it's right leg, left arm. Let's think about that little cross pattern in our lats and in our opposite glute, okay? Cross vector, I think they call that. Let's extend and bring it in. Now let's check in with that right hip. Make sure that right hip doesn't turn out. We're breathing nice and deep. Think of this as rehabilitative work. Nice and smooth. Think about all those little muscles lining your spinal column. Let's do one more. And then we're going to get full extension, reaching your right heel away from your left pinky. Pull, 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 pull for 5, 4, 3, 2, and 1. Bring it in. Good job. Let's take a little wrist rotation here. Flutter your fingers. You guys are doing great. Do I look heaven sent? Like, okay, let's come back to the hands and knees. We're going to finish with a cat-cow, okay? Usually when we do cat-cow, we end up doing it all in the lumbar spine. See, lumbar spine is your low spine. Let's try to do cat-cow from your mid-spine, okay? Because truly, your lumbar spine should be your stabilizer part of your back, and your thoracic spine, your mid-spine, should be the more mobile part of your spine. So let's try to bring some mobility into that mid back. So I'm going to flex from my mid back, not my low back. And then I'm going to see if I can extend by reaching my sternum toward my tower here. And then I'm rounding from my mid back, widening my rib cage. And then I'm gently kissing my shoulder blades together. Let's see if I can get my head involved in this a little bit. And extend without dumping into your low spine if you can help it. And 2 more. And extend. Okay, you guys. You did it. That was a little bit of a joint relief for your low back. I'm going to be doing more of these kind of joint relief exercises for other joints, your shoulders, your hips, your knee, your ankles. And so look for more. And thank you so much for watching. And until next time, bye.